Making the wrong choice with Medicare can cost you your life savings. And yes, we've heard from so many people through YouTube comments and Facebook messages and phone calls complaining that they've spent thousands of dollars unnecessarily simply because they've chosen the wrong plan. There are so many choices to make with Medicare. Luckily, you don't have to do it alone. At iHealthBrokers, we are licensed nationwide and we truly are Medicare experts. So if you have any questions, please feel free to reach out in the comments below or, of course, at the number on the screen. If you've had insurance through your employer in the past, then likely the only choices you've been making are whether to go with an HMO or a PPO. With Medicare, your world really does open up, but more choices means more opportunities to make the wrong choice. So today I'm going to touch upon the basics of Medicare, but I really want to get into those tricky situations. If you're a newbie to Medicare though, make sure to check out the Medicare playlist at the end of this video. That way you get a better understanding. First and foremost, original Medicare is comprised of Part A, which is your hospital insurance, and Part B, which is your medical insurance. Basically, anytime you see a doctor. Part A will help to cover things like
inpatient care in a hospital, skilled nursing facility care, behavioral and mental health, hospice care, home health care, and nursing home care, although I really wish they would asterisk this because this is very confusing to many people.
And Part B will help to cover things like
ambulance services, clinical research, durable medical equipment, this is things like wheelchairs, walkers, etc. Limited outpatient prescription drugs, that's very important. These aren't the prescription drugs that you probably take on a daily basis for your cholesterol or your high blood pressure. These are drugs that are administered intravenously, vaccinations, chemotherapy, certain oral anti-cancer drugs, etc. Also mental health and substance use disorders, and oxygen equipment and accessories. It will also cover medically necessary services and preventative services. Basically, anytime you see a doctor is when Part B kicks in.
Now, for most people, there's actually no premium for Medicare Part A. The deductible is where things can get a little tricky because the Part A deductible is applied per benefit period. This can be confusing and expensive.
So this page on Medicare.gov goes into the costs associated with Part A. We're going to talk about that in a minute, but I want to focus here on the benefit period. So you can read this full text if you'd like. Go ahead and pause it. I'm not going to read the full thing. But basically, a benefit period begins the day you're admitted into the hospital, and then it ends 60 days after you haven't gotten any more inpatient care at that hospital, or it's up to 100 days if we're talking about a skilled nursing facility. So if you need to be readmitted, then you're still within your benefit period. Or, of course, if you haven't been released, then you're still within your benefit period. Now, if you are released and 60 days goes by and you are admitted to the hospital again, either for the same condition or something different, then you would enter into a new benefit period and you would have to pay that deductible once more.
Now, luckily, for the first 60 days, your coinsurance for inpatient care at a hospital is actually $0, and it's the same for the first 20 days in a skilled nursing facility. However, should you need to stay longer than that, then your copay can be hundreds of dollars per day. Now, I've watched some YouTube videos where people advise against Medigap plans, which we're going to talk about in just a bit, because they feel it's unlikely that you would be hospitalized for 60 days or more, and this is really bad advice. If you have a serious medical condition, and unfortunately it's likely that as you get older, you will experience at least one serious medical condition, then it is entirely possible that you could be hospitalized for a period of 60 days. Because remember, it's not just 60 consecutive days. You could be released and readmitted within the same benefit period. And of course, it's very likely that if you need to recover in a skilled nursing facility, that you would be there for more than 20 days. That's just 3 weeks.
A quick pause here because I wanted to do a little further research. So I looked into what the average length of stay for skilled nursing facility care is, and the numbers were really all over the place. There was only one study, though, that was less than 20 days. The rest of them averaged somewhere between 20 to 30 days.
And you could quite easily exhaust your lifetime reserve days. Now, since I mentioned skilled nursing facilities and nursing home care earlier, I want to delve just a little bit further because how Medicare describes it on their website is rather confusing. Medicare does not cover nursing home care in the custodial care sense or long-term care sense. So those are the tricky things about Part A. But Part B can be tricky as well. Now, you do have a premium for Medicare Part B, and that is determined by your income and when you enroll.
So this is Form SSA-44, more commonly referred to as IRMAA, which is the Medicare Income-Related Monthly Adjustment Amount for a life-changing event. Basically, this is the form you would file if you feel that you need to have your Medicare Part B premium adjusted based on your income or a life-changing event. Very often when people retire, they actually end up paying too much for their Part B premium because Medicare is looking at your income from 2 years prior. So when you do retire, when we scroll down a little bit, you'll see the tax brackets. If you fall into a different tax bracket, you're going to want to go ahead and file this form. So the base beneficiary premium in 2024 for Part B is $174.70. But again, it could be more based on your income. So you see here, if you filed your taxes as single, head of household, married, etc., here's your income. And if you fall into any of these tax brackets instead of below these tax brackets, then these are your adjustments. Basically, if you filed as single, head of household, any of these, and you made between $103,001 to $129,000, then you would have to add $69.90 to that $174.70, and so on and so forth.
The deductible for Part B is much easier to understand than Part A because it's just once annually, so once per year. What is a little bit difficult to understand is exactly what's covered and what isn't. The guidelines for Medicare Part B are rather confusing, and if you step one toe out of line, you might be left with some pretty big bills. And what's covered might actually surprise you. For example, let's talk about a routine physical. Now, when you think of a regular doctor's visit, you probably lump a physical in there as well. However, Medicare divides those regular doctor's visits, anytime you visit your PCP, into 3 basic categories.
These are the 3 basic, quote-unquote, regular types of doctor's visits according to Medicare. There's the Welcome to Medicare visit, the Medicare Wellness visit, and routine physical exams. So you're going to see that there is a lot of crossover, and there are a lot of similarities. The differences are rather minute, but what really sets these apart additionally are the timing of them and really the purpose of them. So the first visit is the Welcome to Medicare visit, which is, of course, your welcome visit. Now, this must be completed within the first 12 months of enrolling in Medicare Part B. During this visit, you will review your medical and family history. Your doctor will take some routine measurements such as height, weight, blood pressure. You'll go over your list of doctors and prescription drugs. Your doctor will schedule preventative screenings with you. He or she will look for any signs of impairment, dementia, memory loss, signs of frailty, and you'll go over your health risk assessment, which is basically a questionnaire. Then there is a Medicare Wellness visit. This visit is very similar to your Welcome to Medicare visit. However, this one comes down to the timing. So, a Medicare Wellness visit is after you've been enrolled in Medicare Part B for at least 12 months, and it cannot be within 11 months of your last Medicare Wellness visit, or it won't be covered, because both your Welcome to Medicare visit and your Medicare Wellness visits are completely covered by Medicare. Again, you're going to review medical and family history, take those routine measurements, go over your list of doctors, possibly update them. You'll schedule your preventative screenings, you'll do cognitive wellness exams, and your doctor will put together, any type of medical advice that they feel is necessary based on your current health. And then there are physical exams. These are not covered by Medicare. And these are really meant if something's bothering you, something that you might go to the doctor for, if you're sick, if something's bothering you. Again, you'll review medical and family history, routine measurements. They're going to assess your risk factors based on your health. They're going to do a physical exam of your lungs, head, neck, brain, your abdomen, whatever it is that is bothering you. They'll test your reflexes and your vital signs and send out for blood work or urine analysis. And these tests are all going to be billed individually. So this is the type of regular exam, quote unquote, that's not really covered by Medicare. So you will have to pay for some portion of it, and again, all those tests individually.
So remember, a physical exam that is not in relation to diagnosing or treating a specific complaint, injury, illness, or symptom is not covered by Medicare. Then there are differences between screening tests and diagnostic tests that you need to take into consideration. Now, Medicare covers a tremendous amount of screenings. The list is pretty long. However, you still need to operate within the guidelines to make sure you don't wind up with a large bill. In addition, things can get very confusing when something moves from screening to diagnostic. Let's take a look at colonoscopies, for example.
So here's one of those tricky things with Medicare where we go from screening to diagnostic and how that can actually change how much you're going to pay. And I'm just going to gloss over the fact that Medicare only covers colonoscopy once every 120 months. That's 10 years, unless you're considered high risk, at which point it would cover it every 24 months. This is why we always say it's very important that you understand the guidelines, because if you were to go to get tested for a colonoscopy more regularly than once every 10 years and you're not at high risk, you might be on the hook for the full bill. That being said, if you go in for a colonoscopy following Medicare's guidelines as a screening test and your doctor accepts Medicare, then you actually have no copay, no coinsurance, there's no charge. However, if your doctor finds and removes a polyp or other tissue during colonoscopy, you pay 15% of the Medicare-approved amount. Plus, if it happens in a hospital outpatient or ambulatory surgical center, you also pay the facility a 15% coinsurance. So you went from paying nothing to now paying hundreds and hundreds of dollars. This is again why Medicare supplement plans are so very popular.
Hey, a brief pause. If you like what you're seeing, make sure to like and subscribe. And of course, feel free to leave a comment with any questions or feedback. We would love to hear from you, and YouTube loves to promote videos with lots of comments. And of course, if you do have more in-depth questions, you can reach us at the number on the screen. We are licensed nationwide, and there's no charge for our services. Now, another tricky thing with Part B has to do with enrollment. It's likely that you will be automatically enrolled in Original Medicare, which includes Part B, when you first turn 65. However, if you're not automatically enrolled, it's very important that you do so within the first 12 months of becoming eligible. Otherwise, you may be subject to the Part B late enrollment penalty. Now, this is not a one-time penalty. It gets tacked onto your monthly premium forever. And it is 10% of your premium for each 12-month period that you were without Medicare Part B when you were eligible but did not enroll.
So you're going to take that base beneficiary premium and add 10% for each year that you were without Medicare Part B. Here's the example that they give. If you were to wait 2 full years, then it would be 20%. $74.70 is $34.94. So you would have to add that to your premium to get your new Part B monthly premium. That being said, if you are somebody who has an adjustment, then you would need to pay that adjustment in addition to that late enrollment penalty.
Now, of course, the exception to this is if you are maintaining creditable coverage. So, for example, if you are working past the age of 65 and maintaining creditable coverage through your employer, then you're going to want to go ahead and defer Part B. Make sure you follow the instructions on the back of the card and send it back. If you keep that card, you're keeping Part B and you will be charged for it. And this is problematic for more than just one reason. This ties into some confusion surrounding Medigap enrollment, aka Medicare supplement plans. So Medicare supplement plans will fill in those financial gaps of Original Medicare, i.e. deductibles and copays and coinsurance, and they may impose an out-of-pocket maximum if applicable. We go more into Medigap plans in several of our other videos, which is included in that Medicare playlist I mentioned. So Medigap really is the ultimate protection from some of those big bills that I mentioned. So if possible, you absolutely want to enroll in a Medigap plan. However, in most states, you can't wait to enroll in one. In most states, you are only guaranteed issue a Medigap plan if you enroll in the 6-month window after you turn 65 and enroll in Part B. Pause it, rewind it, write it down. That means that if you defer Part B for a year or 2 or however many, when you re-enroll in Part B, at that time, that's when your 6-month window would begin. Now, if you choose to enroll outside of the 6-month window, that means you may be subject to medical underwriting, which means you could be charged more or denied outright. So please enroll on time. I also want to talk about Medicare Advantage, specifically the differences and similarities between Medicare Advantage plans and Medicare supplement plans.
Medigap plans, aka Medicare supplement plans, will sometimes impose an out-of-pocket maximum, like in the cases of plans K and Plan L, although many of the plans really don't need an out-of-pocket maximum because so many of the out-of-pocket costs are covered. Medicare Advantage plans will always impose an out-of-pocket maximum. For Medicare supplement plans, there may be medical underwriting depending upon when you enroll and what state you live in. With Medicare Advantage plan, there is no medical underwriting ever. With Medicare supplement plans, the costs, i.e. the benefits, are standardized, so Plan G will remain the same Plan G regardless of who your carrier is. And that's not the case with Medicare Advantage plans, although they often will offer lower deductibles, copays, and coinsurance when compared directly with original Medicare. Now, no additional benefits are offered by Medicare supplement plans. They're really just a financial solution to cover those deductibles and copays and coinsurance. On the flip side, Medicare Advantage plans very often do offer additional benefits like dental, vision, hearing, prescription drugs, and many more. Medigap plans, there are no referrals, so you can go to see any specialist without need for a referral, and there is no pre-authorization. That is, of course, not the case with Medicare Advantage plans. If you have an HMO, you'll definitely need referrals, and there's always that issue of pre-authorization, which is a very big issue. And finally, with Medigap plans, it works regardless of who your carrier is. If your doctor accepts original Medicare, they accept your Medicare supplement plan. And unfortunately, with Medicare Advantage plans, not only are there networks, but those networks can be extremely restrictive.
For prescriptions, remember that original Medicare really doesn't cover prescription drugs except with some very limited exceptions. For example, vaccines, medications administered by your doctor in an inpatient or outpatient setting, of course, chemotherapy, and some oral anti-cancer drugs. Luckily, we don't need to talk much more about Part D because things have gotten much less confusing this year. That's right. Bye-bye donut hole. But if you do want to learn more about those big changes that have come to Part D, then I highly recommend you check out this video here. We're also going to go further into detail regarding your deductible and those tiers of medication, and it's very important that you understand that as well. If you've got questions, you can reach us in the comments below or at the number on the screen. Don't forget to like and subscribe, and we'll see you next time.